Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today you're going to learn all about skin cancer, one of the most common cancers in the United States. It is estimated that 1 in 5 Americans will develop skin cancer in their lifetime. Our guest today is Dr. Victoria Sharon, the Director of Dermatologic Surgery and Dermato-Oncology, and the Director of Mohs Surgery at Northwell Health Cancer Institute in Lake Success, New York. Dr. Sharon, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you. Thank you so much for having me. It's a pleasure.
So tell us a little bit about yourself and what made you become a doctor that works with skin cancers.
That's a great question. I would have to say that it's fortuitous in that my grandfather, who is my role model, would take me to all of his dermatology appointments and one day sprung it on the doctor and said, "Hey, do you have a job for her?" And I ended up in high school working for a dermatologist and ended up doing some research for him, later went to college, was interested in biology, medicine. And then when I was in medical school, I ended up doing an internship at Memorial Sloan Kettering. It just happened to be in a melanoma oncology laboratory. And in that laboratory, so I saw both sides of things. Being in dermatology, you see things before they become so advanced. And being in medical oncology, we were looking at salvage treatments and patients who had extensive disease and advanced disease. And ultimately, I decided to go into dermatology to try to be more on the preventative, picking things up early spectrum, because there's more that you can do in that way in preventative care and hopefully, not people picking up things early, not developing to advanced cancers, as we saw in medical oncology.
So the term melanoma, describe that for me.
Melanoma is a one of the types of skin cancer, actually the third most common, that occurs from a cell called the melanocyte, which is a precursor of a mole cell. And essentially it's a mole cell gone bad. And once you develop advanced melanoma or invasive melanoma, as your stage increases, your prognosis goes down in terms of having spread to other parts of your body.
So what are the other types of skin cancers? I know melanoma being one. What are the other types that you could talk to?
The most common skin cancer in the United States is basal cell carcinoma.
Basal cell. Mm-hmm.
The second most common is squamous cell carcinoma. And there are more than 3 million of these cancers combined per year. I think the current estimate might be about 5 million in about 3 million people. And so melanoma, on the other hand, invasive melanoma occurs every year in about an estimated 100,000 people. So it's much less common, but the majority of skin cancer deaths, percentage-wise, based on the number of skin cancers of each of them there are, is most commonly due to melanoma. But in reality, because squamous cell cancer is so much more common, there are actually more cancers due to squamous cell carcinoma each year than there are due to melanoma.
So tell me, what predisposes someone to any of the 3 types of skin cancers that you described?
The most common cause behind skin cancer in about melanoma and non-melanoma skin cancer, over 85%, is due to ultraviolet radiation. So the sun.
So, it's because it's so, the sun is singular, and because that's the most predominant reason why people get skin cancers. Would you say the preventative thing is to wear sunscreen? Would that be the easy thing that we could do to prevent skin cancers? I mean, talk to me about that.
The big answer is yes, but the sunscreen does not block 100% of the sun's rays. Sometimes people don't apply it exactly in the quantity that they should. Sometimes they don't reapply it. Sometimes there are areas where you just can't get a good layer. There's hair. Yeah. And so it's not the only preventative measure, but it is a big preventative measure that has been shown to reduce rates of melanoma.
So are some people predisposed to it more than others?
Yes. So some people may have genetic factors predisposing to cancer, like cancer genes. But a big predisposing factor is fair skin, light eyes, light hair. And that's just because you don't have enough protection at the basal layer. The darker the skin color, the more protection that you have from pigment. But that's not the only, skin color does not mean that you're not going to get skin cancer. Darker skin types do get skin cancer. It's just not as frequent because some people with darker skin may burn a little bit less.
So tell me the prevalence of skin cancers in people who are darker complected individuals versus the fair complected. Do you find that, who comes into your office and you are diagnosing with skin cancer, those that are predominantly Caucasian or fair skin?
And you mentioned 1 in 20 people in their lifetime will get skin cancer, and that's absolutely correct. The rates of skin cancer, at least as it relates to melanoma, is about 1 in 38 for Caucasian skin and 1 in 1,000 for African American skin, estimated at 1 in 160 or so for Hispanics. In my office, the predominant race would be Caucasian. However, because of where I practice at the border of Queens and Long Island, I have all sorts of ethnicities that come in with skin cancer. And I think that that's a little bit more unique based on where we practice and the demographic.
So if I'm to look at my skin, what does a skin cancer look like?
Most people think, skin cancer, it's something that's black or dark. And that can be true, but that's not always true. I know that for melanoma, we talk about the ABCDs. Some of us talk about ABCDE, and it would be a lesion that's asymmetrical with irregular borders, maybe more than one color. It could be brown, blue, red, diameter. Some people say diameter greater than the eraser head of a pencil, for those of us still using pencils. And E would be evolution or change, something that's changing, something that might be bleeding or itching, whereas it didn't before. Squamous cell and basal cell cancers can look pearly. They can have blood vessels. They can have broken skin. Melanomas, too, can be pink. Often basal cells and squamous cells are pink. For squamous cell carcinoma, one of the most often things that I hear from patients is, I thought it was a pimple, and it was a pimple that then didn't go away or grew, and that's why they came in to be seen. I think it's important to know what your baseline skin looks like. And if you notice something that doesn't look like anything else you have, like the ugly duckling, then it's really important to bring attention to that specific lesion. If you have a spot, but you have 10 others that look like that, well, then that may be reassuring that that spot is not something that is dangerous. And it's also important to know that you don't just get skin cancer on your face or on your arms or on your legs. And especially in skin of color, skin cancer is more common in the nails. So make sure that you don't always have your nails covered and polished, that you're looking at what kind of pigment is in the bands of your nails, on the palms of your hands, on the soles of your feet, on the lips, around the eyes, inside the mouth, and your scalp too. For people who have a lot of hair, but women have, they have a part line. They don't cover that with anything if they're not wearing hats. And so you can get skin cancer in the hairline and you may not notice it. So you may need to enlist somebody else to check your hair, like your hairdresser, just to see is something there that shouldn't be there. Or somebody at home who might be able to look at your hair and other places that you may not think to examine, behind your ears, inside the ear.
So if I see an area on the skin that looks a little different or it's changed, it's irregular, as you described, where do I go? Do I don't want to be paranoid, but do I go to my dermatologist? Do I go to an oncologist, a cancer doctor? Where do I go? Do I go to my regular family practitioner? What is my first go-to?
So I think that's a really good question because it depends. Are you somebody who is at high risk for skin cancer and who's had skin cancer before? And the answer would be then you go to your dermatologist. If you're somebody who doesn't have a dermatologist yet, then starting with your primary care doctor or family physician might be a reasonable idea. And they can certainly make a referral to a dermatologist if they feel that they're concerned about this spot or they see lots of sun damage on you. And if you are a very, very moly person, perhaps you should be in the hands of a dermatologist as well.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about skin cancer, one of the most common cancers in the United States. Our guest today is Dr. Victoria Sharon, the Director of Dermatologic Surgery and Dermato-Oncology, and the Director of Mohs Surgery in Northwell Health Cancer Institute in Lake Success, New York. I wanted to know a little bit about how is cancer treated?
Predominantly, if you have a skin cancer, especially melanoma, it's usually treated by cutting it out. When it's on the trunk or extremities, you have a lot of real estate there to cut things out, and your doctor can just numb it up, cut it out, sew you up, and send that to a lab. When you have a skin cancer, a basal cell cancer, squamous cell cancer that's on the head and neck and in areas that are very cosmetically sensitive or where you don't have that much territory, there's a special type of surgery called Mohs surgery. It's MOHS. A lot of my patients think, oh, it's mole surgery, but it's not. It's Mohs, named after the guy who invented it. And it's a special surgical technique of cutting a skin cancer out while trying to spare as much normal skin as possible and give our patients the highest cure rate. Other than surgical techniques, for certain cancers that may be more superficial and aren't melanoma, and where the patient really doesn't want surgery, there are certain techniques like scraping and burning, using certain topical therapies prescribed by your doctor, possibly even radiation, that can be used to treat those skin cancers.
So is skin cancer have a high chance of metastasizing or spreading to other areas of your body?
Basal cell cancer almost never metastasizes. It can, but it rarely does. And the problem with basal cell cancers are that they act like a weed and they locally grow and destroy the normal tissue in that specific area. Squamous cell cancers do have the possibility to metastasize. It depends on what study you look at, but the metastasis rate of squamous cell cancer has been reported to be anywhere from 2 to 15% in studies. I think in general, it's probably around 3 to 5%. The problem is that squamous cell cancer is so common that we do see a lot of squamous cell metastases. Melanoma, if it's caught early, that's great. The metastatic rate is very low. But once it gets a little bit deeper and more advanced, melanoma metastasizes more than the other cancers, more than squamous cell or basal cell carcinoma.
So you talked about the damaging effects of the sun. Talk to me a little bit about those that like to go tanning to the tanning salons and tanning beds. Are they safe?
No, any amount of tanning is ultraviolet damage. And those people in studies who tan beneath the age of 35 have a significantly increased risk of melanoma and other skin cancers. So no tanning that's due to ultraviolet radiation is safe.
What exactly is the sun doing to the skin?
Well, the sun causes cancer. It's causing ultraviolet radiation as a form of radiation that causes mutations.
Is it the heat? Is it chemically changing the skin? What is it doing?
The ultraviolet radiation causes DNA, specifically DNA damage over time. And you know, initially you get ultraviolet radiation and your DNA repairs. But with cumulative radiation exposure, you start to get mutations and not being able to repair those cells as well, or one cell that then suddenly goes wild, then you have cancer. And that's one of the effects of the sun. The sun also causes effects of aging. So UVB rays cause burn, that's the mnemonic that I remember, while UVA rays cause aging effects. And that's the sagging that you see of the skin. It's causing what we call solar elastosis. So normally our skin is nice and tight and rebounds, but when you have ultraviolet radiation, it causes this buildup of broken kind of solar elastotic fibers in our skin, which causes sagging. It also causes blemishes and redness and thinning of the skin in some areas so that the redness is more visible. And in some areas, it causes the skin to become thicker, like alligator-like skin. I don't know why that is. In some areas, it's thicker, some areas, it's thinner.
So let's talk a little bit about sunscreen. What does SPF mean?
SPF means sun protection factor, and it's only referring to UVB protection, which is important because I had just mentioned that UVA causes signs of aging. And if you have an SPF of 30, for instance, it means that you can be in the sun, if you have adequate coverage, for 30 minutes, and it blocks 97% of the sun's rays, which means that it's the equivalent of being in the sun for one full minute without protection. So 97% of the ray blockage is great, but it's not everything. And if you don't reapply, you will lose that protection.
So once you apply the sunscreen and go in the water, how protected are you?
Certain sunscreens will say that they are water resistant. Waterproof doesn't exist anymore. Right. And so if you look on the bottle and it says water resistant, it'll say whether that's 40 minutes or whether that's 80 minutes, and then you should reapply. And that refers to sweating also. If you have a lot of sweating, you're playing sports, that's the equivalent to being in the water for, say, 40 minutes or 80 minutes, whatever that sunscreen tube tells you. And if you're in the water swimming, you feel cool, right? You know, you're out there, you don't realize that the ultraviolet rays actually penetrate the water. So if you think that you're hidden in the water, you're not.
I've seen SPF as high as 50. Is that what I should be buying for my skin?
I think this is one of the most common questions I get from my patients. They say, I've been using SPF of 80 or SPF of 100. The difference between SPF of 30 and SPF of 50 is that you're blocking 2% more of the sun's rays. So an SPF of 30 is almost as good as an SPF of 50, as long as it's applied correctly. You don't need an SPF of 50. SPF of 15 maybe blocks about 93% of the sun's rays. I do think that as a dermatologist, I recommend that you do a minimum of SPF of 30, but you don't need to do an SPF of 50 or 100. SPF of 30, along with other sun protective measures, is good enough, but it has to be applied correctly. Otherwise, it's not actually achieving an SPF of what you think it is.
So talk about a correct application of sunscreen.
If you read the literature, you might see that if you fill up like a shot glass with sunscreen, that is enough to cover the body. But what I typically go by is the 2 fingertip rule. So if you put a good amount of sunscreen, cream sunscreen, on your 2 fingertips, say the index and the middle finger, that would be enough for, say, face and neck. And don't forget your ears. And then I would continue with that for the rest of the body. Obviously, you might need more for the trunk or the legs, and you want to see a nice white coating, and then you want to rub it in. I should also mention for sunscreen, since we've been talking about SPF that only blocks UVB rays, certain sunscreens will say that they're broad spectrum. And what that means is that there is another ingredient in that sunscreen that blocks UVA rays. So you want to make sure that your sunscreen, in addition to saying SPF of 30, water resistant, you want to make sure that it's broad spectrum, because remember, though, that UVA coverage will prevent aging effects.
You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about skin cancer. one of the most common cancers in the United States. Our guest today is Dr. Victoria Sharon, the Director of Dermatologic Surgery and Dermato-Oncology, and the Director of Mohs Surgery in Northwell Health Cancer Institute in Lake Success, New York. So just continuing the discussion about this, I know that our children and our older adults, they really have fragile skin. So I know the sunscreen. Should I also be putting hats on, extra layer of clothes to cover my arms and legs? What else should I be doing to my children and to my older adult parent?
So you point out that that sunscreen isn't the only thing that we should be doing. Wearing a hat, a wide brim hat, would be wonderful because you need to cover the tips of your ears. And any hat will be good too. But then don't forget, if you're wearing a baseball cap, you're forgetting the tips of your ears. And I do operate on a lot of skin cancers on people's ears. So wearing a hat is key, especially to prevent skin cancer on the scalp, ears, cover some of the face. Also, wearing sunglasses is important. What you want to look for with sunglasses is that it says ANSI, so that you know it has ultraviolet coverage. If it doesn't say that, you may just be wearing sunglasses that don't do anything. The color of the sunglasses, meaning how dark they are, actually doesn't affect whether it's protecting you from ultraviolet light. You also should wear a lip balm that has some type of sunscreen in it, because you're probably not going to be putting white cream sunscreen on your lips. Sun protective clothing is key. There are certain clothes that have an ultraviolet protection factor. It'll say 50, where it blocks, again, 99% of the sun's rays. That clothing may be a little bit expensive. So normal clothes do protect against the sun. But if you wear, say, like a white cotton t-shirt, you can see the rays go through. That's only an SPF of about 5 or 8. So that's not enough. But if you have darker clothes that have a higher thread count, you do get more sun protection. I'll say that when I drive to work, some of you may drive far, I actually wear special gloves on my hands, because when you put your hands over the steering wheel, you're getting a lot of that ultraviolet A radiation. I also wear a scarf around my neck, because your neck is, you can wear sunscreen on it, but it also is something that is vulnerable. And if you can be in the shade, that would be great. If you can avoid the peak daylight sun hours, that would also be great. But if not, you have these sun protective measures. I also want to point out that you get sun by reflection from surfaces. So you get it coming down and then reflection from, say, sand, snow, water. So you see a lot. When I used to be practicing in Northern California, I used to see a ton of skiers, and they would have a lot of eye damage. You can actually see solar damage in the eye, and that can be prevented by wearing these sunglasses or glasses that have ultraviolet protection.
How about when it's cloudy outside? Am I getting any rays during cloudy days?
Yes, absolutely. So you may be getting a little bit less, because the clouds do block some ultraviolet radiation, but not all, and you can get a sunburn on days that are cloudy. There's actually a measure that the weather report puts out, and it's the ultraviolet index, so that you can check what the ultraviolet index is on any day, sunny or cloudy, and that'll go from 1 to 11, and 11 being, very dangerous, high ultraviolet index, and 1 to 2 being low.
So I know we're using sunscreen, but I know that the sun also has positive benefits in terms of vitamin D. So if I'm wearing the sunscreen, does that affect my vitamin D levels?
The real world answer is no. There was a study that came out in the British Journal of Dermatology that looked at all of the previous studies done on how people apply sunscreen and their vitamin D levels, and they found no significant effect. I have a lot of patients that tell me, I don't wear my sunscreen because I want to get my vitamin D. But really, if you're applying sunscreen normally, it shouldn't affect your vitamin D levels, whereas you can certainly get cancer and carcinogenic effects from not protecting from the sun.
So it just seems like so many people are very vitamin D deficient. How would you explain that? It's not because they're in the sun, not in the sun. Sunscreen, you said, has no factor in that. So what would your thought be about that?
I think that we're still trying to figure out what the normal appropriate levels of vitamin D should be. And the place that you get vitamin D is not only from the sun, but also from your diet.
Yes.
So we can certainly supplement our diet if we want higher vitamin D levels.
when we're looking at the sprays versus the creams in sunscreen, what would you say is better?
The creams.
The creams.
So if you're going to use nothing, then the sprays are better than using nothing. But if you think about a spray, you don't know if you're getting an even coat. You have to spray for, I think the science says the entire body would be 60 to 90 seconds, which is a lot. And that means that out of, there are only maybe 3 applications for the whole body in each bottle. But you just don't know that you're getting an even coat. You don't know that you're getting everything. You're inhaling these chemicals. And ideally, you should use a cream or one that you can see so you get an even layer. But if you just need convenience, if you want to spray the legs, if that's what you're going to do, then that's better than nothing.
So when it comes down, you mentioned surgery to remove these cancerous growths. How disfiguring is it after surgery?
So that's a common question. And it depends where the skin cancer is and how big the skin cancer is. All in all, having a cancer that's growing ultimately will disfigure patients more than surgery will and can spread to other parts of the body and cause significant morbidity. On the day of surgery, the body gets inflamed, you make cuts, there's bruising, but over time, those surgical scars in the majority of people heal really well. And so I do a lot of facial surgery. Sometimes the side that has surgery looks more rejuvenated once the patient's healed than before. So surgical scar outcomes tend to be very good, especially once you fast forward to 1 year.
So where can someone get in touch with you for more information?
If your patients think they need Mohs surgery, if they have a skin cancer, the email address would be mohs@northwell.edu. That's MOHS at northwell.edu. And that's specifically for patients who have diagnosed skin cancers who are looking for treatment. Otherwise, we have our Department of Dermatology number at Northwell, where you can get an appointment with either one of our dermatologists, or if you have a biopsy-proven skin cancer, then you can get in touch with us, and that's 516-719-3376. And if someone thinks they need Mohs surgery because they have a biopsy-proven skin cancer, they can ask for me and my surgical coordinator.
So if there's one thing, 1 or 2 or 3 words that you can leave with us when it comes down to avoiding skin cancer, what would they be?
That's great. I think of the song from the Supremes where it says, You can't hurry love. You just have to wait. But it's never too early to love yourself. And you have to love yourself first and take care of yourself. And that includes protecting yourself from the sun so that you don't get skin cancer. And so it's just important to start from an early age. Start early.
Well, thank you so much for being here, Dr. Victoria Sharon, the Director of Dermatologic Surgery and Dermato-Oncology, and the Director of Mohs Surgery at Northwell Health Cancer Institute in Lake Success, New York. We hope you stay safe and continue to stay healthy.
Thank you so much for having me here today. This was wonderful for Skin Cancer Awareness Month.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.